So what documents do you verify if you attended the 3 years midwifery program and 18 months nursing program and you want to be a nurse in the UK? Is your 18 months nursing program good enough? Is it going to meet the educational qualification or requirements? Now the answer to that is hey guys, welcome again to my channel. I'm Scholastica. I'm a Nigerian trained registered nurse midwife currently living and working as a nurse in the UK. If this is your first time, don't leave without subscribing. Hit the subscription button below and the notification bell below so you'll be notified when I drop more videos. And thank you so much to all my returning subscribers. I love you guys. That is for you, you, and you. So guys, as promised, I am back with more information about the new test of competence that is going to be in place from June or July this year. So if you are excited, if you are curious, if you want to know the changes, please watch to the ending. And I'm also going to be doing a quick Q&A about your questions that was asked and also general questions that everybody has about this process. So I asked the NMC those questions and I'm going to answer them at the end of this video, so make sure you watch to the end. The new test of competence is going to be designed by Alpha Plus. Alpha Plus is a company that specializes in designing, evaluating, and assessing content. So they are going to be in charge of this new test of competence, and they're also in charge of the OSCE, but because they don't have enough clinical expertise to develop the OSCE, they are going to be collaborating with Nottingham University. And guys, if you see me looking down, that is because I'm looking at the handout that was distributed during the seminar, so pay no mind to me. If you are like me, and you thought that this new theory that everyone is going about was something along the lines of describe the human femur or describe the pathophysiology of angina pectoris, please lift your hands up. Yeah. I know. I know. Me too. I thought that was what this whole theory is all about, and I am so happy. I am so grateful. I am so thankful that I was wrong. In fact, I have never been so happy to be wrong. So guys, there is nothing like that happening. Apparently, we've been having both the objectives and the theory together in the same question bank without knowing about it. So now NMC is going to be splitting it into two parts, which is the part A, which is going to be the numeracy, and the part B, which is going to be the theory. So guys, for numeracy, it's all about pharmacological questions. So you're going to be having calculations. I'm going to give like in the screen now, you should be seeing something that looks like what the question should be about. Example of a numeracy question. A child has been prescribed 175 mg of cefalexin suspension. What volume would you administer if it comes in 125 mg per 5 ml? Or a patient has been prescribed 50 mg of diclofenac. How many tablets should you administer if it comes in 25 mg per tablet? Or calculate the flow rate of intravenous infusion. It's not really difficult, it's straightforward, and this numeracy is going to be 15 marks and it's going to last for 30 minutes. So you have to do all this within 30 minutes. And the part B is a multiple choice question type, which is what we are used to already. That is the same thing we call objectives, mind you. But it's called theory because it has to do with the nursing profession in general. So it's going to be 100 marks and you are going to answer those questions for 2 hours and 30 minutes. Example of a theory question. What do you expect to manifest with fluid volume deficit? A. Low pulse and low BP. B. High pulse and high BP. C. High pulse and low BP. D. Low pulse and high BP. So it's going to be 100 marks and you are going to answer those questions for 2 hours and 30 minutes. Guys, the thing with this objective, this numeracy and theory thing is that you have to pass the two parts. So you cannot pass part A and fail part B and get an overall pass in the CBT. No, you have to pass both the part A and the part B for you to get a pass in the CBT. Currently, we have 6 stations in the OSCE, which is 4 API and 2 skill stations. API means assessment, planning, implementation, and evaluation, and then 2 skill stations. But now we're going to be having a total of 10 stations. 4 API will remain, assessment, planning, implementation, and evaluation, and then 6 skill stations. So currently we have 2 skill stations, right? But now we're going to be having 2 pairs of 2 skill stations. So for example, you're going to be having 2 skills that can be paired together in 1 station, so that the times that you have to go back and forth, leave the station, go to another station, it's going to be reduced, and the candidates won't be exhausted at the end of the day. So they are going to be pairing skills like, let's say, catheter specimen of urine and removal of catheter. Yeah, something like that. Something close, not too distant, or something like peak flow and giving of inhalation medication. Yeah, I think that describes it better. So apart from that, you're also going to be having 2 additional skills stations, which is, the first station is going to assess the candidate's values and behaviors. What that means is that they want to find out how you react under certain conditions. So you'll be given a situation like you are working in a very busy ward, the son of a patient is getting agitated and aggressive because he has been waiting to see his father for the past 4 hours. So what are you going to do? Using the NMC code of conduct to consider the professional, ethical, and legal implications of the situation. So you can also be given a situation like you committed a medication error, how are you going to rectify the mistake? Or you witness another nurse or care assistant abusing a patient, what are you going to do as a nurse? The next station is going to assess the candidate's evidence-based practice. I think what this means is that the examiner is going to be finding out your rationale for carrying out certain interventions. So because of time, I'm not going to read through the question in the screen, but you can pause the video and go through the question, understand it, so you will know what to expect in this station. And don't worry guys, they are going to teach you everything in your OSCE training before you are registered for the exam. Your employer is not going to register you for the exam until they know that you are fully ready to take and pass the exam. So no need to stress about it. If I start explaining these things in details now, it's going to sound strange. So when you come over and start doing it, it will make more sense to you. Assessment, which is the first part of the API, is going to be changed from just normal observations. So we usually take the temperature, pulse, respiration, blood pressure, and then if you have neurological observation in your question, then you have to do the additional neuro-obs. But now they are going to be including more observations. So instead of checking just the baseline observations, you're also going to be checking the full A and E assessment, which is airway, breathing, circulation, disability, and exposure to reflect current clinical assessment. So guys, the planning stays the same. Planning involves writing 2 aspects of care, so which is like a care plan, writing 2 care plans about the person, about the scenario that was given to you in your assessment, and then the implementation is the same thing, which is drug administration. Now another change is to the evaluation. Now currently we do like a written referral to another healthcare professional, but now instead of doing a written referral, it's going to be changed to a verbal referral. So you're a verbal handover. So guys, for support materials, preparation materials for the OSCE and the CBT, they are not going to be basing it only on the Royal Martin textbook anymore. They are going to be having more materials for you, and don't worry, these materials are going to be available on the website, and some of them are already available on the website now, so you can go to the website and download them. So you have NMC code of practice, the NMC blueprint, Alpha Plus test specifications, fusion nurse and fusion midwife standards, and also they are going to be adding more information like the candidate journey, which will provide a step-by-step guide to what to expect, the overview of the nature of care in the UK, and also chief examiner reports. Now this chief examiner report is going to be like a report that is cumulated over a period of time. So it's going to assess the candidates that have taken the OSCE and going to pinpoint places where the pass rate was poor and where other candidates were finding difficulties, so you'll be able to know these areas and then concentrate more on those areas. So guys, those are the changes that are going to be implemented in the test of competence that is going to start probably in June or July. But if you have any problems, if you have any questions about it, let me know in the comment section. I'm going to ask NMC again on your behalf and reply you in the comments. So guys, just keep me informed. I want you guys to be successful in this journey. I don't want you guys to go and spend your money unnecessarily to pay agents to come over to the UK. You can do this on your own. Trust me, it's really easy and straightforward. So that is it for the test of competence. Let's go to the Q&A. I know a lot of people have been waiting for this part, so I'm not going to disappoint you. Now I'm going to be reading out some of the questions that I have here and then saying the answers that NMC provided for those questions. So the first question I have here is about the English proficiency test. Now are there any plans to make changes to the IS pass score? Unfortunately guys, the answer is no. So NMC already changed the writing score. They already reduced it from 7 to 6.5 sometime last year or the upper year. And also the OET has already been changed. The writing score is now C+ instead of a B+. So there are no plans currently to reduce the reading score, sorry guys, or the writing score anytime soon. Another question is, apart from the IELTS and OET, is NMC willing to accept TOEFL or PTE? The answer to that is no. For now, there is no plans to accept any other exam, so they are only going to accept IELTS and OET for your English requirements. Another question is for mostly Nigerians. This is very common. So what documents do you verify if you attended the 3 years midwifery program and the 18 months nursing program, or if you attended the 3 years nursing program and the 18 months midwifery program and you want to be a nurse or midwife? Did I put that question well? Let me just say it again, right? So what documents do you verify if you attended the 3 years midwifery program and 18 months nursing program and you want to be a nurse in the UK? Is your 18 months nursing program good enough? Is it going to meet the educational qualification or requirements? So guys, the answer is yes. Now NMC is only interested in the qualification that got you to be a registered nurse in Nigeria or in your country. So even if you did like the 3 years midwifery program and then 18 months nursing program and you want to become a nurse in the UK, all you have to do is verify the 18 months program that made you a nurse in that country. Now of course you have to get like a letter from your school and the nursing council agreeing that yes, this 18 months program is enough for you to become a nurse in your country. So that is all you need. This other question is for new graduates. Now the question is, can you write the CBT if you don't have your RON license or certificate? The answer is yes, guys. You can do your UK registration and write your CBT even before you get your RON license. So there's no need for you to be so crazy about this 1 year internship that everyone is all about. This internship, I think it just came into play like maybe 2 years ago. When I was in school, there was nothing like internship. NMC is only interested in you passing your nursing council exam. So once you pass your nursing council exam and you already know that you are a registered nurse, the only thing that is absent is the license. You can start your NMC UK registration and write your CBT. You don't have to waste time waiting for your license or waiting for your certificate or even doing the 1 year internship. Please don't waste your time. Just start the NMC process, okay? So this question is for those that already have their nursing license but have not been practicing. So this is for the full-time housewives that are in Nigeria or in any other country. You already passed your nursing council exam, you're already a registered nurse, but you decided not to work and now you want to come to the UK and be a registered nurse. What is the way forward? So the NMC is saying that you have to become registered as a nurse in the UK. And after that, you have to do a refresher program. So there is no refresher program first and then registration last. You have to come over to the UK, get your PIN, and then do a refresher course before you can start working. Okay, so this last question is for nurse educators. So I know there are some lecturers, there are some those in the education sector that have really gone far up there and they want to move to the UK to be a nurse. The thing is that if you are not interested in being a bedside nurse, if you want to continue being a nurse educator in the UK, the route is very different from becoming a bedside nurse in the UK. So for nurse educators who want to remain nurse educators in the UK, you don't have to register with NMC UK. NMC UK is only like a regulator for nurses and midwives. You that is going to be a nurse educator has nothing to do with NMC. All right, so what NMC is suggesting is that you should pursue further education. So pursue further teaching qualification, like get a postgraduate degree in healthcare education, and then you can get a job and you can complete your training. Then you can just be what you want to be. So if you don't want to be a nurse, if you don't want to be a bedside nurse or midwife in the UK, don't do the NMC registration. I think I'm going to research more into this nurse educators part and then make a video about it, because I'm not too sure the process about how nurse educators can become nurse educators in the UK. So I'm going to do more research about that and then get you guys all the information you need. So guys, that is the end of this video. If you enjoyed it, please give me a thumbs up, share, comment and like, and thank you so much. My subscription count is rising. You guys don't know how happy I get when I come on YouTube and I see that someone extra has joined the family. I'm like, oh yeah, welcome to the family. So guys, thank you so much. Your subscription means a lot to me. I'm really happy when the count rises, and I love you guys. You know I do. I will forever love you guys. Okay, so till next time, be here when I drop the next video, and bye.